Got a big, huge emergency room bill? Let's talk about what to do. Because most medical bills are wrong, there's only one right way to pay them. And you can do it in three simple steps. First is you're going to make sure that the bill you received is a real bill. And the way to do that is to make sure that it has what's called CPT codes. CPT codes are to medical service what barcodes on products are to a retail store. So the CPT code for medical services for an ER visit level 1 is different than a barcode or CPT code for level 2. That's why it's really important that you get a real bill that has CPT codes. I tell people, you know what you really need to do is that if you just call and say, hey, I need a real bill with CPT codes, that you may get the runaround. And it's just faster if you just say, hey, I need a UB-04 form for services I received in an emergency room visit. And that's just cutting to the chase to say, hey, I know what I'm talking about. I want CPT codes. That's a real bill. If it doesn't have CPT codes, which are 5 digits, sometimes dash 2 digits, sometimes it starts a letter in front. If it doesn't have CPT codes, it's not a real bill. I tell folks all the time, you know what? Insurance companies won't pay anything that doesn't have CPT codes on it. Why should you? Once you get a real bill with CPT codes, you're going to go to step 2, going to medicalbillrelief.com and just uploading the bill. And up will pop the actual most fair retail price for the medical services you receive. And those are Medicare rates. So Medicare rates are the lowest, the most fair retail rates that providers accept for services that they provide. A lot of providers will say, you know what, if we accepted Medicare for everyone, we wouldn't be able to stay in business. First of all, I have to say there's some studies that show that's not so true. Many people who do this work offer 2 times the Medicare rate for the services that you receive. And that's what you get in step 2. You go to medicalbillrelief.com, up will pop the fair retail price, which is the Medicare rate for the services you receive. Then you're going to go to step 3, which is saying, okay, I'm calling back the provider's billing department, the emergency room, the hospital. Often it's a hospital. Sometimes not. Sometimes it's a standalone emergency room. I'm going to call back the billing department and say, hey, yeah, that $10,000 bill that you sent me, in my case, I am willing and able to pay $3,000. Now, it sounds like a crazy discount, but it's really not unusual to even have a more significant, huge difference between the MRSP and the Medicare rate. So it is what it is. The thing that's really important, though, is when you do an AI search for the CPT codes, you're making sure that it is the appropriate services you receive. Because unfortunately, a lot of EDs, emergency departments of facilities and standalone facilities, will charge you for an ER level visit 3 when it was really an ER level visit 1, or maybe an ER level visit 5 instead of an ER level visit 2, which is why you plug in the CPT codes into an AI search to make sure it sounds like services you received. So people say, well, how will I know if what I got was level 1 versus level 3 or 4 or 5? What you're going to do is plug in the CPT code for the services you receive from an ER visit. It'll say ED level 3. What you're going to do is then plug into the AI search ER level 3. What is the billing criteria to be able to bill appropriately and legally a level 3 ER visit? So we're seeing lots of cases, even a former Surgeon General of the United States, his stories of going to the ER and he was just dehydrated and he got charged for like a level 5, which is like you come in, someone's having an MI and they're basically dead or almost dying. You're trying to save their life, bring them back, as opposed to putting an IV in and giving them fluid. It happens. So this is why it's really important that you pay your ER bills in the 3 steps in the right way, because as part of this process, you're making sure that you're getting charged for the services you received appropriately and not getting upbilled. So there you go. Please don't pay a bill that's wrong or unfair. It's your money. Protect it. You can fight your medical bills like a pro. Visit medicalbillrelief.com and check the notes below for more support.